LMSW exam practice questions and answers with explanations. 25 hardest questions. Question 1. A social worker is seeing a 15-year-old girl who admits to using drugs. What should the social worker do first? Report the girl to the police. Inform the parents immediately. Assess the extent and nature of the drug use. Refer her to a drug rehab center. Assessment is always the first step before intervention or reporting, unless immediate harm is present. Question 2. Which of the following is an example of triangulation in family therapy? A couple working together to solve a problem. A parent involving a child in a conflict between the parents. 3 family members attending therapy. A therapist seeing 3 families at once. Triangulation occurs when 2 people in conflict bring in a third person to reduce tension. Question 3. The social worker's primary responsibility is to the agency, the client, society, the profession. According to the NASW Code of Ethics, the primary responsibility is to the client. Question 4. A client tells a social worker that they plan to kill their neighbor tonight. The social worker should maintain confidentiality, notify the police and the neighbor, tell the client to think about it overnight, schedule an extra session tomorrow. The duty to warn/protect, Tarasoff, overrides confidentiality in cases of specific threats to others. Question 5. In the DSM-5, malingering is classified as a personality disorder, a somatic symptom disorder, a V-code, other conditions that may be a focus of clinical attention, an anxiety disorder. Malingering is the intentional production of false symptoms for external gain and is not a mental illness. Question 6. What is the best approach when working with a client from a different culture? Treat them exactly like every other client. Ask them to explain their culture to you in the first session. Be aware of your own biases and seek to understand the client's cultural context. Refer them to a therapist from their own culture. Cultural competence involves self-awareness and learning about others. Question 7. A social worker at a hospital is asked to discharge a patient who has no home. The social worker should discharge them to the street, advocate for the patient and find appropriate housing/shelter first, refuse to see the patient, let the doctor handle it. Social workers have a duty to ensure safe discharge planning. Question 8. Which stage of Piaget's development involves the concept of object permanence? Sensoromotor, pre-operational, concrete operational, formal operational. Object permanence usually develops during the sensoromotor stage, 0 to 2 years. Question 9. An LMSW is providing therapy to a child. The parents request the child's records. The social worker should provide them immediately, refuse to provide them, review the records and discuss with the child, if age appropriate, before deciding, following state law, destroy the records. Parents generally have rights to records, but the social worker must consider the clinical impact and specific state laws/agency policies. Question 10. The concept of self-determination means the social worker decides what is best for the client. The client has the right to make their own choices. The client must do what the court says. The agency sets the goals for the client. Self-determination is a core value where clients have the right to choose their path. Question 11. Which type of group is focused on providing members with information about a specific topic? Support group, therapeutic group, psychoeducational group, task group. Psychoeducational groups combine education and support. Question 12. A social worker notices a colleague is coming to work under the influence of alcohol. The first step is to report them to the board, tell the supervisor, talk to the colleague privately, ignore it. The Code of Ethics suggests talking to the colleague first if you believe they are impaired. Question 13. Which of the following is a symptom of schizophrenia? Hallucinations, delusions, disorganized speech, all of the above. These are the hallmark symptoms of schizophrenia. Question 14. In social work research, validity means the test is consistent. The test measures what it intends to measure. The test is easy to administer. The results are the same every time. Validity refers to accuracy. Reliability refers to consistency. Question 15. A strengths perspective focuses on the client's problems and deficits, the client's abilities and resources, the therapist's expertise, the agency's funding. The strengths perspective looks at what is right with the client rather than what is wrong. Question 16. Termination of services should occur when the client runs out of money, the social worker gets a new job, the client has met their goals and no longer needs services, the social worker is bored. Services should end when they are no longer helpful or goals are met. Question 17. A social worker is subpoenaed for client records. They should first send the records immediately, consult with an attorney or supervisor and seek to protect client privilege, ask the client for permission, hide the records. Receiving a subpoena doesn't mean you automatically release everything. You must first follow legal/ethical steps to protect privilege. Question 18. What is empathy? Feeling sorry for the client, understanding and sharing the feelings of the client, giving the client advice, fixing the client's problems. Empathy is feeling with the client, not feeling for sympathy. Question 19. The ego in Freudian theory is the moral center, reality-based mediator, source of primitive drives, unconscious mind. The ego mediates between the ID, drives, and the superego, morals. Question 20. An LMSW's role in advocacy is to tell the client what to do, speak on behalf of clients to influence policy or secure resources, only provide therapy, stay out of politics. Advocacy for social justice is a core social work responsibility.